Hello, this is Dr. R. Jaganesh, Associate Professor working in SRIST. Today I will discuss about tetrodotoxin. Okay. So tetrodotoxin is a marine neurotoxin. It's a highly potent neurotoxin found in certain marine animals. So primarily pufferfish it is present. So but also in some amphibians, octopus, and the shellfish. Okay, the main role is that blocks sodium channels. Then it leads to paralysis and potentially death. So the other name of tetrodotoxin is fig-poison, maculotoxin, spheroidine. Okay. It acts as a, I told earlier, it acts as a potent neurotoxin. It is named after the fish Tetrodotoxin. That means it has four toothed or Tetrodon pufferfish. It comes in the family of Tetrodontidae or Diodontidae. In Japan, it is called Figo poison. Okay. So actually, it has three other names: Figo poison, maclotoxin, spheroidine. Okay. So when you see about the properties, it is a non-protein and colorless crystals. So chemical name is amino perhydroquinazolone. Formula is C11H17N3O8. When you see about the stability in the heat, it acts as a heat stable compound except in alkaline environment. See about the solubility, it is slightly soluble in dilute acetic acid, slightly soluble in dry alcohol and ether, and particularly insoluble in other organic solvent, and it is a water soluble molecules. You see the molecular weight, it has 319.27, that is the molecular weight. So earlier it is identified from California newt, salamander fish, parrotfish, starfish, frogs, frogs of the genus Atelopus, blue-ringed octopus, Xanthid crabs, boxfish, horseshoe crabs, marine snails. Okay. We see about the mechanism of action. It is bind to the site voltage gated sodium ion channels where it binds and blocking the passage of sodium ions into the nerve cells. Actually, TTS is a selective sodium channel blocker, means it binds to and blocks voltage gated sodium channels in nerve and muscle cells. This blockage prevents the transmission of nerve signals leading to paralysis. So virtually insoluble in all organic solvent but soluble in acidic medium. Okay, this one already we discussed about the properties. So in the structure, there will be three nitrogen atom of tetrodotoxin are present in the molecules as guanidine moiety. Actually, it has a 10,000 times more lethal than cyanide. Okay. So LD50 level is 5 to 8 microgram per kg of the animals. So this is about controversies about the tetrodotoxins. So actually, toxin is not produced by the fish themselves, but rather accumulated from bacteria or dinoflagellates in the environment. And also, it is secreted by the fish itself. And bacteria like Vibrianaceae family, Pseudomonas tetrodontis, Photobacterium fosforium. So this kind of bacteria also secrete. And when you see about the various parts of the fish. It's present in liver, ovary, muscle, and skin. This is the controversy about tetrodotoxins. Next, we'll say about the intoxication effect on humans. So, ingestion of tetrodotoxin can cause a range of symptoms, including numbness, tingling, muscle weakness, difficulty in breathing, gastrointestinal problems, and it leads to respiratory failure and death. So far, there is no known antidote for TTX poisoning, and the treatment is primarily supportive. Actually, after ingestion of TTX, there will be a rapid onset of weakness, dizziness, paresthesia in the lips, tongues, throat will be there. In the extreme case, nausea and occasional vomiting occurs. Okay, then it leads to salivation, muscular weakness, respiratory distress. Actually, in very severe cases, muscular paralysis and death will occur. Deep the apparent respiratory paralysis occur after 6 to 24 hours following injection of toxic fish. Cysteine is amino acid that is reported to react with tetrodotoxin by binding in vitro at pH 7 and produce a non-toxic substances. When I say about the pharmacological potency of TTX, the initial action of TTX is blocking the sodium channel of muscle and nerve block. Direct blocking action in the muscle fiber is usually longer than the nerve block. Toxin found in highest concentration in kidney and heart and lowest in brain and blood after 20 minutes. Tetrodotoxin has proved to be a useful tool of the analysis of events which occurs in the nerve result in the impulse propagation. It acts as a good hypertensive agent and produce fall of blood pressure of the cat in the doses of 2 to 3 microgram per kg in intravenous administration. And another analysis done in the guinea pig that will inhibit the stimulation of respiration and metabolism in the preparation of in vitro guinea pig brain, where they administered zero point 0.3 to 3 microgram of tetrodotoxin per kg of animal they administered. So clinical uses it acts as a pain relieving compound in the case of patients suffering from the neurogenic form of Hansen disease, nothing but leprosy. So in the aspect of pain relief, so far analyzed have taken animal studies already done about the pain reliever action of tetrodotoxins. The first one is they for both the cases they use the cancer patient. In the first case, they have taken 31 cancer patients. So for them they administered 15 to 90 microgram of tetrodotoxin through intramuscular administration for continuous 4 days. In this, 17 out of 31 cancer patients reported pain reductions. And also one more study, analgesic effect also observed in another study. Here, the scientists used 41 cancer patients. In this, they administered the tetrodotoxin amount is 30 microgram per kg of animals, twice daily for 4 days. Here, they reported 21 out of 41 cancer patients reported pain relief.